Hello, my name is Desirae Shirley. I'm a research coordinator at the University of Florida, and today I'll be walking you through our study that evaluates the effects of multiple sensory motor inputs on postural stability in individuals with autism spectrum disorder. Autism spectrum disorder, or ASD, is characterized by social communication impairments and repetitive and stereotype behaviors. Deficits in sensory motor behavior are also highly prevalent in individuals with ASD. During tasks of postural control, previous studies have found that individuals with ASD showed increased postural sway when either vision is occluded using a blindfold or proprioception is interrupted by standing on a foam platform. However, little is known regarding the degrees to which disruptions of both visual and proprioceptive inputs affect postural control in ASD. Our study aims to evaluate the interactive effects of both visual and proprioceptive inputs on postural stability and complexity in individuals with ASD relative to typical developing controls. 43 individuals with ASD and 24 controls were recruited from the University of Kansas research registries and community advertisements. ASD diagnoses were confirmed using DSM-5 criteria, including the ADALS-2 and ADIR measurements, along with expert clinical opinion. Our preliminary sample shows between group differences in age and IQ scores. However, as we continue to collect data, we do plan for the comparison groups to be matched based on age, sex, and IQ scores for analysis at the conclusion of the study. Visual inputs were occluded by turning lights on and off, while proprioceptive interference was manipulated by attaching lightweight tendon vibrators to each Achilles tendons on participants' ankle joints. These vibrated at a frequency of 80 Hertz when turned on and creates a transient proprioceptive illusion of lengthened Achilles tendons for both legs during the task. Each condition included 3 45-second trials. Postural sway variability was quantified using the center of pressure trajectory length and COP standard deviations in the medial, lateral, and anterior posterior directions. Postural sway complexity was quantified using the detrended fluctuation analysis of each COP time series. Individuals with ASD showed increased COP length and COP standard deviations in both directions relative to controls, as seen in previous studies. On the next few slides, you'll find controls data on the left and patients data on the right. For this and the next slide, the blue bar represents vibration on conditions and the orange represents vibrations off. Proprioception is the primary input for postural control. When the proprioceptive illusion was available, controls showed increases in COP length and COP standard deviation in the AP direction, as consistent with previous studies. Significant differences were not found within the ASD group. However, you can see that the standard deviations of these tasks are extremely large, which greatly affects the analysis of these statistics. In controls, DFA measurements in both directions decreased significantly during vibration on conditions. As proprioceptive illusion shows effects on balance in controls, no effects were found in patients. On this slide, the blue represents lights on trials and the orange represents lights off. DFA in the MO direction also increased in controls during lights on trials relative to lights off stances, but no significant effects were seen in the ASD group. On this slide, the blue bar represents female participants and the orange bar represents male participants. Female individuals with ASD showed decreases in COP length and COP standard deviations in the MO direction relative to male patients, but the sex difference was not identified in controls. Our study is the first to identify sex differences during gross motor tasks involving multiple sensory interferences in ASD. To conclude, individuals with ASD showed increased postural sway variability compared to controls. While postural control in typical developing controls is affected by proprioceptive illusion or degradation of visual feedback, alterations of these sensory inputs did not disrupt postural variability or complexity measurements in individuals with ASD. Investigating sex differences in sensory motor functioning are needed to clarify neurodevelopmental processes that may vary between male and female individuals with ASD. Thank you.